As a psychiatric nurse practitioner treating adults with ADHD for the past decade, I get this question at least once a week. Is it safe to drink alcohol while on ADHD medication? On the surface, doesn't seem like a very good idea. But what about adult patients with ADHD who are prescribed therapeutic doses of their medically necessary medication? My name is Jonathan Murphy, psychiatric nurse practitioner. Today, I'm going to break down for you some harm reduction guidelines for adults that are choosing to consume alcohol socially or recreationally. Before we get into specific recommendations, let me be clear. I'm not here to judge your choices. I'm here to help you make safer ones. Here's the reality. There's a whole world of adult decisions that you need to navigate. Holiday parties, work events, social gatherings. Whether you're unwinding after work, having a few too many on the weekends, or simply enjoying an annual White Claw at the company Christmas party. This is that murky gray area between complete abstinence and it's time for an intervention. But isn't alcohol always bad? Yes. In fact, it's toxic for your liver. That's just biology. What am I supposed to do? Just sit here and finger wave and pretend like we don't live in a world of wine coolers and brunch with your besties? Not only that, it's been normalized and promoted throughout Western culture for at least the past 100 years. So here you are, surrounded by the world that we live in, and yet we get stuck with all the guilt and shame of a bad decision. This is where harm reduction comes in. Before the 1980s, people still consumed alcohol. Everyone just drove drunk all the time. Then there was an ad campaign all about finding a designated driver. That's harm reduction. Drinking wasn't eliminated, but the rate of death associated with drunk driving reduced significantly. That's the approach that we're taking here. Before I break down the practical guidelines, let me tell you some of the underlying drivers that I've seen in my trauma-informed framework, the survival modality. For people whose nervous system is in charmer mode, they end up leaning on drinking to remain numb inside and performative on the external. In the general, they're drinking to manage anger and stress, workplace conflict, frustration and agitation. Of course, alcohol abuse can be in any of the 8 modes. I've just found that those in charmer or general mode are most likely to drink to the point where they black out. Now let's get into some of the specific medications. Any methylphenidate or dexmethylphenidate medication is technically contraindicated with alcohol. The reality is a once in a blue moon isn't gonna matter much. But anything more than that is more work for your liver, and you're more likely to feel it the next morning. Amphetamine-based medications are going to be a safer option because there's not an interaction between the two substances. If you are on methylphenidate and you do enjoy more than an occasional adult beverage, you may want to cut back or switch your medication. At the very least, you'll have way less of a hangover. If your medication's optimized, then stick to the plan and take your medication every day like a vitamin. Here's the simple formula. ADHD medication is a therapy for your brain. Alcohol is a recreational substance that isn't very good for you, but you might have fun using it. Kind of like Zyn pouches, social media, online gambling platforms, and Krispy Kremes. The reality is, you still need to navigate a world of instant gratification as an adult with ADHD. Okay, now it's time for some harm reduction guidelines that actually work. Do not have more than 1 drink an hour. Stimulant medication can mask the effects of alcohol. And the last thing you want is for it to hit you like a freight train all at once. And make sure to prioritize water in between drinks. Go for that 1-to-1 ratio. And I know this might sound like something your mom would say, but here's why it matters. Dehydration amplifies every negative effect of alcohol. The headache, the nausea, the 7 different types of anxiety, all worse when you're dehydrated. Think of adding water to the water slide so your alcohol can have a good time going down the slide and then it's out of your system. You gotta give your body time to process some of that alcohol before you go to bed, or else you're not gonna get the restorative sleep that you need. Stop drinking 1 hour before bed and camel up, because the future you is gonna feel way better about the decisions they made at 2:30 in the morning. And you know you gotta have food in your stomach to soak up the alcohol. You're not trying to get wasted fast, you're trying to have a good time without negative consequences. And never drive. This one's the non-negotiable, but you already know that. Designated driver, Uber, Lyft, robot car, ride share. Everything that I would say about the combination of ADHD medication and alcohol, I would say about alcohol. Your liver needs a break to function properly. If you don't have some dry days in there, your liver's never gonna have a chance to recover. So what if you mess up? Real talk. In one way or another, you're gonna mess up sometimes. So what if you take your Vyvanse, go to your friend's wedding, have 6 drinks instead of 3, and then make an impromptu speech about the bachelor party? Hey, there's no shame here. You're gonna need some harm reduction the next day. Drink a lot of water and skip the medication if you can afford to sleep it off. Here's another important detail, and the data is clear on this. Adult patients with a diagnosis that are not taking medication have a higher rate of substance abuse. So if anything, getting proper treatment for ADHD is going to decrease the risk that you develop a problematic relationship with alcohol. But what's the line between problem drinking and everything else? If you're getting wasted every day, day drinking, or waking up hungover all the time, talk to a provider that you can trust. The goal is to increase the quality of life for all my patients. That means I need to acknowledge the reality. There are social events, there are adult decisions, and there is alcohol. My job isn't to tell you never to drink. I just need to give you the answer to the question I get every week in my office. The answer that doesn't sell you short and helps you enjoy a night on the town safely with 100% less shame. Understanding what mode your nervous system could be in is the first step toward harm reduction. And if you want to dive deeper into the survival modality, I got the full playlist for you right here. And if you want more on ADHD medication optimization, I got a playlist for you right here. And go ahead and hit subscribe if you want to keep receiving practical strategies from a nurse practitioner who won't sell you short.